Hey there, Pharmacy Insider fam. Welcome back to the another mind-blowing video of artificial intelligence in healthcare. This is part 2. If you have missed the part 1, don't panic. Just click that I button there, but hold your horse. Finish this video first, alright? Oh, if you haven't subscribed yet, what's the hold up? Show some love to the like button, hit subscribe and ring the bell icon. Trust me, it's like having your very own virtual medtech information provider. Ding ding, let's go. Are you tired of restless nights and struggling to fall asleep? Well, what if I told you there's a groundbreaking technology that can predict your risk of sleep disorders? Stay tuned as we dive into the fascinating world of machine learning and its ability to revolutionize the way we approach sleep disorders. In a recent study published in the open access journal PLOS ONE, researchers from Virginia Commonwealth University School of Medicine and Northwestern Feinberg University School of Medicine unveiled a game-changing machine learning algorithm. By analyzing demographics, lifestyle data, physical exam results, and laboratory values, this algorithm can accurately predict whether a person is at risk of sleep disorder. Now, you might be wondering why this matters. Well, did you know that the prevalence of diagnosed sleep disorder has significantly increased in the past decade? It's crucial for us to understand and reverse this trend because sleep disorders are linked to serious health conditions such as diabetes, obesity, and depression. To better grasp the impact of this breakthrough, the researchers used a machine learning model called XGBoost. They analyzed data from over 7,900 patients who participated in the National Health and Nutrition Examination Survey, and the results were astounding. The machine learning model accurately predicts the risk of sleep disorder diagnosis with an impressive accuracy rate of 87%. It used a subset of 64 variables, including factors like age, weight, depression, and waist circumference. Dr. Samuel Y. Wang, one of the researchers involved in the study, highlights the significance of this research. He says, what sets this study on the risk factor for insomnia, apart from others, is not only identifying various associated variables, but also visualizing the contribution of each in a highly predictive model. So, what does all of this mean for you? It means that with the help of the machine learning, we can take proactive steps towards identifying and managing our risk for sleep disorders without solely relying on subjective judgment or bias. By utilizing this powerful technology, we can make informed decisions about our sleep health, prioritize a good night's rest, and ultimately improve our overall well-being. And there you have it, folks. The future of sleep disorder prediction is here, thanks to the wonder of machine learning. Remember, better sleep means a better life. Imagine a world where a simple tool could prevent blindness in thousands of newborns worldwide. Well, thanks to groundbreaking research, that world may soon become a reality. A team of international scientists and clinicians from the UK, Brazil, Egypt, and the US has developed a remarkable deep learning AI tool that can diagnose a leading cause of childhood blindness, retinopathy of prematurity, or ROP. ROP is a condition that affects premature babies where abnormal blood vessels grow in the retina, potentially leading to the retinal detachment and irreversible blindness. Dr. Konstantinos Balaskas said, retinopathy of prematurity is becoming increasingly common as survival rates of premature babies improve globally. It is now the leading cause of childhood blindness in the middle-income countries and the US. In fact, it's estimated that around 30% of newborns in sub-Saharan Africa have some degree of ROP. Yet, with the lack of eye care specialists in many years, this condition often goes undetected and untreated. The team trained their AI learning tool on over 7,400 images of newborns' eyes. Then they put it to the test against assessment made by the senior pediatric ophthalmologist. The results were astonishing. The AI tool proved to be just as effective as the human expert in identifying ROP and distinguishing normal retinal images from those that could lead to blindness. The researchers ensured that their AI tool works safely across different ethnic groups, making it accessible and beneficial to everyone. One of the researchers said, "We didn't stop there. We further validated our tool on datasets from the US, Brazil, and Egypt. And guess what? The AI tool continued to show remarkable accuracy across different continents." Imagine a trained nurse capturing images that can be assessed by the AI tool, leading to the timely referral for treatment without the need for manual review by ophthalmologists. With this groundbreaking AI tool, we have the potential to prevent thousands of babies from experiencing preventable blindness. No child should go blind from ROP. As the research continues, scientists are working towards incorporating this tool into real-world clinical settings, reshaping the field of ophthalmology and opening up access to the sight-saving treatments. The future looks bright for newborns at the risk of retinopathy or prematurity thanks to the power of AI. Researchers from UNSW Sydney and Boston University have developed CrankMS, an AI tool that can detect signs of Parkinson's in blood sample up to 15 years before symptoms appear. CrankMS uses machine learning to analyze metabolites in the body, revealing unique markers that may indicate the onset of Parkinson's. In a limited study, CrankMS predicted Parkinson's disease with up to 96% accuracy, allowing for early diagnosis and treatments. CrankMS goes beyond the statistical approaches, considering metabolite association to understand the body's processes. Unlike traditional methods, CrankMS uses all available data without reduction, identifying key metabolites driving the prediction. Atypical symptoms like sleep disorder can appear decades before motor symptoms. CrankMS can detect the risk of developing Parkinson's at the first sign of these symptoms. Larger validation studies are required, but CrankMS achieved up to 96% accuracy in detecting Parkinson's diseases. The researchers also found interesting connection between metabolites and Parkinson's diseases. For example, triterpenoids, which are commonly found in apples, olive, and tomatoes, were found in lower concentration in the blood of those who later developed the disease. Further research could explore whether these foods naturally protect against Parkinson's. Presence of fluorinated alkyl substances in people who develop Parkinson's raises questions about environmental factors. CrankMS is freely available and user-friendly, generating results in under 10 minutes on a standard laptop. CrankMS offers new possibilities for early disease detection and understanding, benefiting patients with Parkinson's and beyond. New research has shown that artificial intelligence may hold the key to detecting early signs of cognitive decline and Alzheimer's diseases, even before symptoms become apparent. By analyzing a person's speech, advanced machine learning and natural language processing technique can identify subtle changes that are often missed by family members or primary care physicians. Researchers at UT Southwestern Medical Center used cutting-edge technology to study the speech pattern of 206 individuals, including those with mild cognitive decline and those who were unimpaired. They analyzed recorded description of artwork, approximating controversial abilities, and examined factors such as speed motor control, idea density, and grammatical complexity. The team compared the speech analytics with traditional biomarkers such as cerebral spinal fluid sample and MRI scan to assess the accuracy of the digital voice biomarkers in detecting cognitive impairment and Alzheimer's diseases. Dr. Ia Fazar, a researcher, said, in the past, studying speech pattern in patients was labor-intensive and often unsuccessful processes. The change in the early stage of the disease were frequently undetectable to the human ear. However, with the development of the machine learning and natural language processing, we have found a novel method that performs well in detecting cognitive decline and identifying patients with evidence of Alzheimer's disease. The study demonstrated that capturing a patient's voice recording took less than 10 minutes, while traditional neuropsychological tests typically take hours. This breakthrough offers primary care provider an easy and efficient screening tool for identifying at-risk individuals. Dr. Ia Fazar said, if larger studies confirm our findings, the use of artificial intelligence and machine learning to analyze vocal recording could revolutionize the way we diagnose cognitive decline. Early detection would allow patients and their families more time to plan for the future. It would give clinicians greater flexibility in recommending effective intervention. Dr. Ia Fazar and his team at UT Southwestern are continuing their research, collecting voice recording as a part of a follow-up study funded by the National Institute of Health. With the potential for earlier diagnosis and improved intervention, artificial intelligence may significantly impact the lives of those at risk of cognitive decline and Alzheimer's disease. Today, we bring you the groundbreaking research from Northwestern University. A recent study challenges the belief that a cytokine storm causes death in COVID-19 patients. Instead, it highlights the significant role of secondary bacterial pneumonia. Let's dive into the key findings. Scientists at Northwestern University analyzed medical records of patients with severe pneumonia and respiratory failure. They found that almost half of the patients who required mechanical ventilation support developed secondary bacterial pneumonia. Using machine learning, researchers discovered that patients who recovered from secondary bacterial pneumonia had a higher chance of survival, while those with unresolved cases faced a higher risk of death. These findings challenge the idea of a cytokine storm causing fatalities in COVID-19 patients. The researchers emphasized the importance of preventing and treating secondary bacterial pneumonia in critically ill patients. Secondary bacterial pneumonia was common in COVID-19 patients requiring mechanical ventilation. The study suggests that it is not the virus itself, but the unresolved secondary pneumonia that drives death rates. Dr. Benjamin Singer, the senior author, highlights the significance of identifying and treating secondary bacterial pneumonia in critically ill patients, including those with COVID-19. The study challenges the concept of a cytokine storm causing death in COVID-19 patients. Instead, complications like secondary bacterial pneumonia played a significant role in outcomes. The researchers developed a machine learning approach called CarpeDiem to analyze electrical health records and group similar percentages into clinical state. The study involved the SCRIPT program, which identified new biomarkers and therapies for severe pneumonia. An expert panel examined lung samples related to secondary pneumonia. Next step involving integrating molecular data with machine learning to understand recovery variation. The researchers aim to expand their technique to larger datasets and make prediction for improved patient care. This study opens possibilities for using machine learning in healthcare, providing insight to ICU physicians and developing more effective treatments for diseases like COVID-19. Preventing and treating secondary bacterial pneumonia in critically ill patients, including those with COVID-19, is crucial to improving survival rate. Rigorous scientific research and innovative technologies are key in the fight against COVID-19.